Julie, you could probably stay here if you want. Consider and take appropriate action on appointments to the Austin-Travis County Public Health Commission Board of Directors. We've got Julie Wheeler and Ana Almaguel,
Do you want to drive? Okay.
who will present to us.
I'll just say this looks like a really fabulous group of people on this commission. I'm really excited about those that volunteered to serve.
Oh, yeah. Oh, okay. Are they good? All right.
Larry Wallace Jr. is going to get a star for number of committees.
Volunteering. He stepped down as mayor and filled his dance card pretty fast.
Dance card, there you go. That's what it is.
All right. Well, welcome again. We are here to talk about the Public Health Commission. So the Commissioners Court took action back in, I want to say January of last year, that directed various county departments to meet with the City of Austin to try to create a public health commission that would really work to coordinating our efforts, try to find where there are community gaps, and just maybe have a better coordination and a better plan. So over the last year and a half now, we have been meeting, trying to come up with bylaws, get an idea of what the structure will look like, but step one of that is helping to put together a board. There will be 9 members of the board, 4 ex officio members as well. I'm going to pass it over to Pilar and Ana Almaguel to give you guys a little bit more background and walk you through these appointments.
Thanks, Julie. As Julie mentioned, the purpose of of this new commission is to address disparities that were exacerbated by the pandemic and exposed by the pandemic. And so we took very careful steps as a group to ensure that we could find the right makeup of this new commission. And so we interviewed over 20 candidates. We received over 35 applications. It was a great opportunity for the ex officio members to become familiar with each other since I'm new, and since it's this group includes Central Health as well. So 20 interviews, a lot of time we spent to make sure that we had the right combination. Of course, nothing is perfect, but we think that we found a great team. So the ex officio members include our local health authority, Dr. Wallace, somebody from Austin Public Health, which is the director, Adrian Stirrup, myself from Travis County Health and Human Services, and Mike Giesling from Central Health. Those will be the ex officio members. We met several times to develop the bylaws, the provisions, and to interview the candidates. Next.
I'm not driving. Media, can you help with the next slide, please? Or maybe not.
There it goes.
So there were, there you go. There were things that we were looking for to guide us. This wasn't everything that we were striving for, but we wanted to make sure that we had somebody from the Dell Medical School, from the Department of Population Health, that we had somebody from school districts, an allied health professional, a medical professional, a hospital executive, and private employer. Demographics was very important to us, and we found most of these and more. Next. So the 9 people that have been proposed to you are listed here: Chris Crookman, Kara Dalhusen, Jesuita Killian, Enrique Lin Shao, Martha Lujan, Natalie Poindexter, William Rice, Larry Wallace Jr., and Jacob Whitty. Next. So, like I said, this group brought a rich background combined together. They had backgrounds or experience in the following areas or in their education. I won't list all of them, you can read them, but harm reduction, working and representing the LGBTQ plus community, people working in data with pediatrics. Several of them either had a certificate or a master's in public health. There was people who had lived experience and shared their experiences with us in either somebody in their family or themselves having to work through the healthcare system and the public health system and what their experiences were. We have people who are bilingual, a veteran, somebody in biomedical science. Next. The candidates, the 9 candidates, reflect our community. There's an even representation. We've got people who are Anglo, African American, Hispanic, Asian. There was there were at least 2 people who had prior experience creating new advisory boards and creating new governance. At least 2 people working in HIV prevention and HIV care management. Several of them were either epidemiologists or had training in epidemiology. One of them worked in youth mental health. A couple of them worked with our unhoused population. There's a social worker, there's a peer specialist, and so the list just goes on and on. It took a long time to create this great combination of people coming together to help us improve our public health system. And so we present this slate to you.
Thank you. Thanks for your work. Commissioner Gomez or Commissioner Shea, any questions?
I don't have any questions.
Okay.
Thank you.
I just want to say I'm really thrilled that we have such frankly, a talented and experienced group of people who are willing to serve on this new body. And I'll also say, I think we, as at least a country, but at least a community, saw during the pandemic how essential a public health system is and how dysfunctional ours had become. And I think it's because over the years, we didn't have as many public health threats. Polio was a real threat. The year I was born, 1955, children were being crippled for life and dying because they contracted polio in swimming pools. I mean, so there was like really serious illnesses that were spreading throughout the population, and it required that we have a population-wide response to the threat. And we got really good at eliminating those threats, and I think people just lost the understanding of the need for a public health system. But it's a very clear projection from the impacts of climate change that we will see more and more tropical diseases moving north, and we will see more and more pandemics. So it's essential that we have a really fully functioning public health system. And I think that's as I understand it, the intent, behind this new commission. And it's certainly the qualifications and the experience of the people that we are appointing are really outstanding. So I'm encouraged about what I believe will be the right kind of emphasis and focus on rebuilding our public health system so that it's really functional the next time we're threatened with something like COVID. Thank you.
Commissioner Trevelyan?
So I want to commend staff as well. Let's see, first I'll get closer to the mic. They always tell me that. Right. I want to commend the staff for working together as well, for looking across the community and identifying people who are willing to serve. You know, as we went through the pandemic, we saw a lot of the disparities, and we saw, you know, whether it was food deserts, whether it was lack of access to the places that could give you vaccines. What we learned was there is still a tremendous number of gaps, and we need to have a team that can define what the issues are, talk to the public about social determinants of health, but then build an education process that is continuous, and then interact with our community in such a way that they don't feel ashamed for getting access to resources that will make them healthier and their families healthier. So I am very pleased with the team that was put together, and very interested in how we build a sustainable public education process about how we address the social determinants of health and why it is important to understand that an ounce of prevention is worth a pound of cure. So thank you for what you've done. The working through the difficulty of the job, making sure that we were taking the right approach, not a safe, cautious approach because we don't want to be criticized, but something that considers the real needs and the types of professionals that need to be in place to address them. So thank you for doing that hard work on our behalf, and it's something that we want to provide for all of our constituents, and that's access to better healthcare tools and opportunities. So thank you.
Commissioner Howard? Nothing? All right. Okay, so do we have a motion yet?
I'll
Move approval.
Second.
Okay, motion from Commissioner Shea, second from Commissioner Trevelyan for approval. We have no callers on this. All those in favor, please raise your hand. Passes unanimously. Thanks.
Thank
all
you.
Thank
very
you all.
much.